Hello, my name is Sue McCarthy Robinson. I'm a psychiatric mental health nurse practitioner and a student doctor of nursing practice at Purdue University Global. Thank you for taking the time to hear about my DNP project. My project focuses on critical issue in psychiatric nursing, reducing burnout and improving retention among psychiatric nursing staff in a psychiatric and skilled nursing facility located in the southwest part of the United States. The problem and why it matters. In psychiatric care, nurses face intense emotional, mental, and physical demands every single day. They work with residents who experience severe mental illness, challenging behaviors, and frequent crisis. Over time, this repeated exposure can lead to emotional exhaustion, which is the core component of burnout. At the facility where this project is being implemented, leadership and staff have expressed concerns about high levels of stress, fatigue, and the challenge of keeping experienced psychiatric nurses. And burnout isn't just a workforce issue, it affects patient safety, therapeutic engagement, team morale, and overall quality of care. Addressing it is essential for both nurses and the patients they serve. The purpose of the goal of the project is to implement and evaluate a structured burnout reduction intervention for the psychiatric RNs, LPNs, and CNAs. The goals of the project are to reduce emotional exhaustion among the psychiatric nursing staff, improve job satisfaction and stress levels, positively influence retention and turnover trends within the psychiatric units. To evaluate these goals, I'm using a validated tool such as a Maslach burnout inventory, emotional exhaustion subscale, along with the job satisfaction and stress survey, completed before and after the intervention. And what was implemented? The intervention occurs over a 10 to 12 week period, includes 3 core components. First, I facilitate wellness and psychoeducation sessions that focus on stress management, emotional regulation, and mindfulness and realistic self-care strategies tailored specifically for the psychiatric nurses. Second, I partner with the nurse leadership to enhance supportive communication and intentional check-ins, helping ensure that staff feel heard, valued, and psychologically safe, all key factors in reducing burnout. And finally, staff, were encouraged to provide ongoing feedback to guide the intervention and ensure it meets the, day-to-day needs of the psychiatric workforce. The evaluation significance and closing to measure impact. I am comparing pre- and post-intervention scores on burnout, perceived stress, and job satisfaction, while also examining trends in absenteeism and retention during the project period. The goal is a 10 to 20% reduction in burnout symptoms, which is consistent with outcomes found in the literature that I've been reviewing. This project is important because it supports not only the well-being and sustainability of psychiatric nursing staff, but also the quality and the consistency of care provided to vulnerable patients. If successful, this intervention could become a sustainable model for other psychiatric and long-term care facilities across the Southwest and beyond. Thank you for taking the time to learn about my DNP project and for supporting efforts to enhance the well-being of psychiatric nurses and the patients that we serve. Thank you.